So this is a physical examination of the legs and lower extremities. First you want to have a look at the whole leg. Just make sure the color is pink and there's no swelling or any other abnormalities that you can see. And then you want to feel along the joint lines for any swelling or if the patient complains of any tenderness. You want to also note that. You want to look for any scars or anything else as well. Then you want to do range of motion tests. So the first one will be for the hip, and you want to extend the leg to a 90-degree angle, and then you want to measure it. And then you can put the patient's leg back that way. And then to test for extension of the hip and knee, you're going to want to have your hand under the patient's ankle and have them push your hand into the bed. And it should be at a 10 to 15 degree angle. And the final test for range of motion for the hip is you want to abduct and adduct the hip to make sure that one moves as well. Check for external and internal rotation. So you want to flex the knee to a 90-degree angle and rotate it externally and internally to make sure it moves. This test is called the anterior drawer test, and it's for the knee to assess any ligament damage. You're going to want to extend the patient's knee to a 90-degree angle, sit on the foot, and pull the tibia distal from the knee, and there should be no movement. If movement occurs, it's a sign of a ligament damage. Another test to assess for ligament damage. You want to extend the knee like that. Put your hand on the knee, and then take the foot like this, and rotate it medially and laterally. And if there's any clicking or popping sounds, that is a positive sign for the ligament damage. The final test is for a reflex of the knee, and you're going to take the reflex hammer and hit right below the patella, which is the kneecap, and the leg should contract.